All right, hello everybody. We're continuing on now with our third muscle video, and we're going to move down into the trunk region and take a look at some of the muscles there. And the next one, if you're following along with your study guide, will be the trapezius muscle, commonly called the traps. So we need to come over here to the back side, and let me multiple select these so we can show both the left and the right sides. So the trapezius is a very large muscle that has a diamond shape to it, as you can see there. Pretty complex muscle. Has a whole lot going on with this muscle. Has multiple things that it can do. So you can actually contract different parts of it. Look at the grain of the fibers and how they're running. That kind of gives you a clue that you're going to be able to contract different parts of this muscle when you need to. That's not uncommon with some of these larger muscles. And obviously this is the muscle around the sides of the neck that extend down to the shoulders that are visible, pretty visible on everybody. All right, let's turn on our pins so we can see our origins and our insertions. All right, so you've got origins up in here along the occipital bone, and then all of these, so right along the vertebral column, you've got a bunch of origins with this muscle as well. And then your insertions are over here. That's actually that, remember the spine on the scapula on each side? That's where they're inserted there. And then also if we rotate all the way around, you have insertion points over here along the clavicle as well on each side. So big muscle, lots of things going on. Now if you've ever exercised your traps, you know that things like shoulder shrugs are exercises that you can do for the trapezius. And if you take a look at those origins and insertions, if you're contracting this top portion, those fibers are going to pull on the clavicles over here and help you raise your shoulders like that. So you're going to have elevation that goes on that allows you to shrug your shoulders. And then let's think about what's going on over here, where you've got all these origin points running up and down the vertebral column and all those fibers that are extending over here. And again, this is what you're seeing right there. That's that spine of each of your scapulae. So think about that. When those fibers are pulling on the scapula on each side, that's going to allow you to do this type of movement where you pull your shoulders back. All right, if you remember from our joint action terms, if you're thinking about a coronal, a frontal plane, if you move something back this way or this way towards the midline, that's adduction. So you're actually adducting the scapulae when you use that portion of the trapezius. Abduction, you're moving away from the midline. Adduction, you're moving toward the midline. All right, let's move farther down. Big, gigantic, huge muscle. Left and right. Latissimus dorsi, that's the next one on your list. So I'm highlighting those for you. You can see those are huge muscles. Those are also called the lats. And if we rotate around, you can even see those underneath the armpits there on each side. Big, extensive muscles. And let's take a look at the pins. So our origins. And so the latissimus dorsi is actually deep to this portion of the trapezius. So you have origin points in red there running all up and down the vertebral column, and then down here on the sacrum, and even over here on the ilium of the os coxa on each side. So those are your origins, and then you've got all these fibers that are running almost in a shell-like fashion, and look where they're headed. Surprisingly, we kind of zoom in here, scan upward there for a second. All right, I deselected the latissimus dorsi there for a minute. I'm going to strip off some of these other muscles so we can see where the latissimus dorsi is actually attached. because it might kind of surprise you. It's actually attached. Let's show our pins. Here we go. We actually have to rotate it around. If you look right there and right there, the latissimus dorsi is actually attached to the upper part of the humerus. It's kind of hard to see in there. So imagine what's going on with this. Origin over here, this part stays stationary. These fibers are actually pulling on the upper part of the humerus over there. And so this is responsible for a couple of different things. One would be hyperextension of the arm. So if you remember with the shoulder joint, flexion is you're raising it, because flexion is always in a sagittal plane. So this is flexion of the shoulder joint. Extension, you're lowering. Hyperextension, you're going backwards beyond anatomical position. So when you do that, you are using your latissimus dorsi muscle for that. Also depression of the arms. So if you have your arms raised overhead and you bring them down like that, you're using your latissimus dorsi muscles to make that happen. Think about if you were doing chin-ups or pull-ups, pulling yourself up to a bar, you're depressing your arms, you're bringing them down in an inferior direction, and you can feel your latissimus dorsi muscles contracting when you do that. Or if you think about people, they do rowing exercises with weights when they want to work out their latissimus dorsi muscles, where you're pulling your arm back like that, you're hyperextending, and as you pull it back like that, you're contracting your latissimus dorsi muscle to make that happen. All right, so an antagonist to this, which we'll come back to, will be the deltoid muscle. That's the muscle there on your caps of your shoulders, and we'll see that the deltoid does some opposite movements to the latissimus dorsi. All right, here's another view for us. Now we're going to move on to the next one, pectoralis major. So we all know where our pecs are, right? Left and right, the big, large muscle there, upper part of the chest. And this is another muscle which sometimes people are surprised to realize is inserted onto the humerus, the upper arm. So let's turn on our pins. So you can see the origins over here are running along the sternum and wrapping around to the clavicle. So that's the part of the muscle that's going to stay stationary. And then you can see how all the fibers are running. And did you realize that your pectoralis major muscle, actually you can see if you follow the highlighted muscle there, it is inserted onto the upper part of the humerus. So when this muscle contracts, this part stays stationary, those fibers are pulling onto that part of the arm. So what's going to happen? That's actually going to move your arm in this direction. Okay, so if you look at the action there, now it's got other things that it does, but you're pulling the shoulder here, this region, you're pulling that towards the sternum. That is also adduction, because we're taking the arm, shoulder area, moving it towards the midline of the body. You're doing adduction. And think about it now, what exercise would you do if you wanted to work out your pectoralis major muscles? You're going to do push-ups. So think about it, if you had a bar down like this, you push the bar up. If you were laying down, what's your arm doing? What's happening here at the shoulder? You're actually adducting. You're bringing that towards the midline. Same thing if you do push-ups. That's another type of exercise that you can do to work out your pectoralis major muscle. So when you push up, what's happening to the arm? It's actually adducting toward the midline of the body. Pectoralis major also does some other things. It's responsible, you can kind of see how it's wrapped around the humerus there a little bit. So it's going to be involved in rotation of the humerus. So you can put your hand on your pectoralis major muscle and rotate your humerus medially toward the midline like that, and you can feel it contracting as that happens. The pectoralis major is also involved in flexion of the shoulder, and again, flexing the shoulder joint means we're raising the arm up like this. And you can feel that your pectoralis major muscle is contracting and helping you with that type of motion as well. So the pectoralis major muscle is big and has several different actions that it does. All right, and notice on your lab guide, this is considered to be antagonistic to the trapezius muscle, because one of the things that the trapezius does is the trapezius helps you adduct your shoulders back like that by pulling on the scapulae, and so the pectoralis major muscles are helping you move in this direction. So it's actually a opposite type movement. So because of that, the pectoralis major can be considered antagonistic to the trapezius. All right, let me deselect. Clear those pins. Let me hide the pectoralis major muscle there. And hang on, I'm going to have to get a different view. All right, I had to change views there for a second. And you'll notice here around the thorax, on this side we've got all of the more superficial muscles shown, just like the pectoralis major that we were just talking about. And over here on the right-hand side, those more superficial muscles have been stripped off. All right, so we were just talking about the pectoralis major here, and now let me hide that one. We'll say goodbye to it. And then notice right there, that's called the pectoralis minor muscle. Let me deselect that for a minute. I'm going to get rid of the deltoid there. All right, we'll strip that off as well. All right, pectoralis minor on this side, pectoralis minor, oops, highlighted the nerves, over on that side. And let's turn our pins on. All right, so you've got the origins that are down here on these ribs that you can see there. 1, 2, 3, 4, 5, ribs number 3 through 5. Those are the origins, and then your insertion point is actually up here at the shoulder joint. Kind of see where that's located. And so what's going to happen when this muscle is contracting, you can see how the fibers run on a diagonal. It's going to be pulling on this point over here. And so what is going to wind up happening? It's going to pull on the shoulder. It's going to cause your shoulder to roll forward like that towards the rib cage. Another thing, this is another one of those muscles where the origin and the insertion can reverse when you need to breathe deeply. So think about the origin being up here and your insertions down here on the ribs. Just like we talked about with the sternocleidomastoideus muscles, when you need to breathe deeply, origin and insertion here reverses. It pulls on the ribs and helps expand your rib cage so that you can breathe more deeply. All right, I'm going to actually stop this video right here, and then I'll pick up on the next one. We'll continue on with these trunk muscles.